Euthanasia and assisted suicide explained. What is euthanasia? Euthanasia is an act which intentionally ends someone's life in an attempt to relieve their suffering, and the lethal substance is administered by someone else, for example a doctor. Assisted suicide is when the lethal substance is administered by the person themselves. So if it was a lethal injection, they'd administer it themselves. There's two types of euthanasia: active and passive. Active euthanasia is when the person's life is ended through a practical action, e.g. poisoning or suffocating. Passive is when you withhold all life treatment, okay? So if they're on advanced life support, you stop the advanced life support. There's voluntary and there's non-voluntary. Voluntary is when the person is in a state of capacity and can give consent to the euthanasia. Non-voluntary is when the person is in a vegetative state, for example, they can't give consent. First and foremost, euthanasia is illegal in the United Kingdom. However, it's legalized in places like Switzerland. However, it's illegal for a UK doctor to inspire someone to go to somewhere else and take euthanasia, because that would be contradicting the principle of non-maleficence of good medical practice. Euthanasia can enable people to relieve their suffering, it stops prolonged suffering, it may free up resources for the NHS, and it gives people autonomy and the opportunity to make decisions about their own healthcare. However, on the other hand, it's really difficult to verbalise criteria in which euthanasia is allowed or disallowed. For example, there's a bill being passed in Parliament right now on assisted dying, which states that in terminally ill patients in the last 6 months of their life, they have the opportunity to perform euthanasia. However, it's still subjective. Furthermore, if someone decides to perform euthanasia when they're in a state of distress and they later change their mind, they may not be able to do so because they might be under sedatives. So if you've chosen to do euthanasia, that for the fact that you can't really change your decision, that may be something that's a disadvantage. What else? If it's not well documented, then relatives may face court cases relating to manslaughter and murder. So it's fundamental that these cases are very well documented. It may also contrast with some people's religious beliefs, because essentially you're playing with God, you're deciding whether they live or die. That contrasts with quite a lot of people's religious beliefs. Those, ladies and gentlemen, are the things that you can talk about in a medical school interview to smash that interview and secure your place in medical school. Thank you for watching.